Hi, Ms. Berry.
Hi.
My name is Julie. I'm going to be your student physical therapist today.
Okay.
How are you doing?
Good. How are you?
I'm doing well. Have you ever been to physical therapy before?
No.
Okay. So I'm just going to give you a quick rundown of how it's going to go. The first 15 minutes, in total, it's going to take about an hour. The first 15 minutes are going to be me and you kind of talking, and I'm going to kind of get to know you and everything. And then the last 30 or so minutes, I'll be kind of doing a physical exam, taking different types of measurements, kind of assessing. And then the last 15 minutes will be us doing a treatment.
Okay. Sounds good.
So let me just confirm your age.
Yeah.
How old are you?
58.
58? Okay. And what is your date of birth?
2/2/61.
Okay. What do you do for a living, Ms. Mary?
I'm an adjunct professor at a community college in the area.
Okay. What college?
San Antonio Community College.
Oh, okay.
So, yeah, I teach English there, so
Okay.
keeps me busy.
If you see me writing, it's just so I don't forget anything, okay?
That's fine.
How many hours a week do you work?
I work 2 days. My classes are about 6 hours apiece, and then the other days I'm doing prep for those classes.
Okay.
So maybe 30 to 35 hours or so.
Okay. So just so I have it straight, 2 days a week you're in class and the other 2 is prepping?
Yeah.
Okay.
Yeah.
Okay. Do you have any exercise? Do you do anything outside of work for exercise or have?
Oh, yeah. I teach spinning classes 3
Okay.
nights a week, so.
Okay. That's cool. 3 nights a week. How long is each class?
About an hour long.
About an hour.
Yeah.
Okay. Okay.
But I also do poetry readings sometimes in the community, so.
Okay. I was
It's
just
kinda
going to
hard.
ask if you had
Yeah.
anything else outside of that.
Yeah.
Okay. Are you having any limitations with either work or exercise?
I definitely have pain when I'm working, and then when I'm teaching, looking up at my clients as I'm on the bike there, kind of looking out increases my pain. And then when I'm doing the poetry readings, I can't be as expressive as I want to, so that's been a little limiting for that.
Okay, all right. Well, we'll definitely try and get you back to doing all of that
Great.
without pain. What is your living situation like right now?
Oh, my husband and 2 kids.
Okay. Do you live in a 2-story or 1-story?
2-story.
2-story. Okay. So now, can you go ahead? We're going to kind of get into where everything's at. Can you go ahead and show me the pain?
Yeah, it's kind of right side of my neck here.
Okay.
And then also I have some kind of a headache as well.
Okay, you have a headache?
Yeah.
Where's the headache?
Right above my eyebrow here, kind of on my eye, kind of right behind there.
Okay. So just to clarify, right side kind of dull pain, and then you have a headache on the eye.
Yeah, that one's more of like a sharp pain that kind of comes and goes, but this one's always there, kind of just like the aching, dull pain back there.
Okay. So I kind of drew a picture, and I want you to let me know if this is right. How does that look?
Yeah, that looks good.
Okay. So we're going to talk just about the neck pain for a little bit. What is the pain level right there?
Maybe like a 2 out of 10.
2 out of
10 feels like right now. Yeah.
Okay. At its worst, what would you say the pain is at?
Oh, up to like a 7 probably.
What a 7? Okay. At its best, what would you say?
Like a 1, maybe.
Okay. And then for talking specifically about the headache now, what is the pain level right now?
Like a 1. A little bit there, yeah.
Okay. At worst?
Probably 5 out of 10 for that one.
Okay. At best?
0. Sometimes it goes away completely, which is nice.
That's good. That's good.
Yeah.
Do you feel like there's a relationship between those two, your headache and your neck pain?
Yeah, probably my neck, when it starts to hurt for a while, it will kind of lead to the headache pain. So yeah, I guess they're kind of connected.
Okay. Are you having any numbness and tingling in those areas?
No.
Okay. Any pain or symptoms in the front of your neck?
No.
Okay. What about in your arms?
Nope.
Chest? Upper back?
Nope.
Okay. Nothing in your tummy area?
No.
Okay. And in your lower back or your legs?
No.
Okay. Perfect. Have you had any dizziness recently? Difficulty swallowing or making words? Okay. Have you fallen for no reason?
Nope.
Had any double vision or nausea?
Nope.
What about coughing or sneezing? Have you noticed any change in your symptoms with that?
No.
Okay. All right. Sorry about all those questions.
No,
There's
that's
just
okay.
gotta ask them. So for anything, now I want you to tell me about anything that makes the neck pain worse.
Definitely, when I'm teaching the classes and I'm looking up, that definitely aggravates it a lot.
Okay.
The neck, so.
How bad does it get, like on a scale from 0 to 10?
That's probably gets up to like the 7. After like a whole class, definitely hurts a lot. So.
And then what about for the headaches? Is there anything that makes that worse?
If I'm holding that position where I'm looking up, when my neck's hurting, maybe like 5 minutes later I'll get a headache. So kind of if I hold that position for too long or something.
So now jumping back to the neck pain. Sorry, it's a little confusing. Is there anything that makes the neck pain feel better?
Looking down, if I just get out of that position, or if I like lay down on my side, it usually feels better.
Okay.
So, or sometimes, if I kind of massage that area too.
Okay.
Kind of the same for the headache actually too.
Okay.
So.
Same. About how long after doing those things would you say that it feels better?
A few minutes probably.
Okay, and you said it was the same for the headache.
Yeah.
Okay, just wanted to get that. How do you feel in the mornings? How do you?
Oh, I'm sorry.
How do you?
No,
feel
I
in
just
the
got totally
morning?
distracted. Yeah, that. Okay, pretty good.
Okay. And what about throughout your day?
It depends on what I do that day, if I have work or if I'm teaching classes, the spin classes, but it definitely gets worse throughout the day.
Okay. What about in the evenings?
That's when I usually have the worst headache.
Okay. Does it keep you from sleeping?
Sometimes, but I can usually kind of go back to sleep right away. Doesn't really keep me up that long.
Okay. So I'm taking a look at the form you filled out, and thank you for filling that out. We really appreciate that. So I'm just going to go through a couple things with you. It says you're taking ibuprofen, and that you've been feeling down, depressed, and hopeless. Can you expand upon that a little bit for me?
That's just been kind of recently, just with me not able to work out as much. Kind of it hurts when I exercise, so that's been pretty depressing. But that's about it. So.
Okay. Let's see here. You also report a family history of cancer. Do you mind telling me what type?
My dad had skin cancer.
Okay. And then you also said a family history of stroke. Do you mind telling me more about that?
Yeah, that's my uncle.
Okay. All right. And I see that you put that you have ADD. How are you managing that, or does that interfere with your life at all?
Not so much anymore. I've had it for a while, but usually when I exercise, it kind of gets those endorphins up and kind of keeps that anxiety under control. So that's been like the best form of treatment for that.
Okay.
For sure.
All right. Sounds good. So I noticed that you got a little distracted earlier.
Yeah, sorry, it happens a lot.
Would you find that there's any other barriers? So sometimes with physical therapy, we would like to send exercises home.
Oh, okay.
And do you think that there would be anything that would keep you from doing that?
Probably just getting distracted, trying
Okay.
to just stay focused on it. So
All right.
that's about it.
You had said best that you learn best by doing. So
Yeah.
what I'm going to do is I'll make sure to practice the exercises here with you.
Okay.
That way you know what I want you to do when
Perfect,
you go home. Okay.
Yeah, if I can do them here, then I'll kind of know what to do when I get home.
Exactly.
So.
Exactly. So have you ever had any X-rays or MRIs?
Yeah, I did on my neck actually like 4 days ago.
Okay.
So.
Do you happen to know the results of the X-ray?
They said negative, so.
Okay. And you had said that you were taking ibuprofen.
Mm-hmm.
How often are you taking that?
Whenever I have pain.
Okay. Do you find that it helps?
Yeah.
And how much are you taking, like the milligrams, do you know?
Like 600.
Okay. Okay, so go ahead and tell me when all of this started.
I've had the neck pain kind of on and off for a while now, but it's been getting a lot worse the last few weeks, and the headache's been kind of more recent, so.
Okay, the headache is new.
But I was watching a meteor shower, like 3 weeks ago, and so I was looking up, which that's definitely aggravates it, so it really, I noticed more of the neck pain after that, and then the headaches, but I don't really I don't know, there wasn't like one thing that made it hurt worse, but it's just been kind of gradually getting worse over the last 3 weeks. So.
How long ago was the meteor shower?
3 weeks.
Okay. Okay. And you just said it's been getting worse over time?
Yeah.
Okay.
Unfortunately. That's why I'm here.
No problem. Have you ever had anything like this happen before then?
No.
Okay. Alright. I know we talked a little bit about getting you back to spin class and doing your poetry readings and everything else.
Mm-hmm.
Is there anything specific that you would like to get out of physical therapy?
Just like get rid of the pain and get back to doing the things that I like to do. I have a poetry reading in about 3 weeks. I want to be able to do that without having any pain in my neck or have a headache at all. So.
Okay, that sounds like a good goal.
Yeah.
Okay. All right. So we're gonna go ahead and move on to the physical exam.
Okay.
But before we get started, I just want to go ahead and see what your pain level is right now, as far as the neck pain and then the headache as well. Okay. So on a scale from 0 to 10, what is the pain in your neck?
That's probably still like a 2. I think.
Okay. And then for the headache, what is the pain level right now?
Still about a 1.
Okay. All right. So one thing that I want to do while you're just sitting there, I'm going to have you remove your shirt and I'm going to take a look at your posture, okay? Okay, if you can go ahead and stand up for me. Alright. You can go ahead and turn and face that wall. And then if you could turn towards this wall. Perfect. And then turn and face me. Okay. What I want you to do now is I want you to go ahead and walk towards this wall and then walk back towards the other wall, okay? Okay, you can go ahead and have a seat again. And you can put back your shirt on. So what I'm going to do is I'm going to check your shoulders and I'm going to check your upper and lower back a little bit.
Okay.
Just to cover our bases, okay? So first thing, I'm going to have you raise both arms up, if you will. Okay, awesome. Can you raise them out like this? Perfect. Can you bring them across like this? And the other way. Perfect. Okay. So now I'm going to have you do those same motions and I'm going to apply some pressure, okay? So let's just do, let's start with the other side, I'm sorry. Let's go ahead and start with this one, okay? I'm going to apply some pressure. Any pain with that? Okay, go ahead and bring it out. Any pain with that? Okay, go ahead and bring it across the body. Pressure. Pain with that? Okay. Now we're going to go ahead and do the other side. Go ahead and raise the arm up. Pain with that. Go ahead and bring it out. Any pain with that?
Nope.
Now bring it across. Perfect. Okay, I'm going to have you go ahead and stand up for me. If you could go ahead and bring this arm back for me. Okay, any pain with that?
No.
Okay, go ahead and apply some pressure. Any pain with that?
No.
Okay, now we're going to do the other side. Same thing. Any pain?
No.
Okay, I'm going to apply some pressure. Any pain with that?
Nope.
Okay. What I want you to do now is I'm going to go ahead and have you reach down for your toes. Okay, any pain with that? You can go ahead and come back up. Okay. Now you're going to go ahead and go down and I'm going to apply some pressure.
Okay.
How did that feel?
Good.
Good.
Stretch.
Okay. All right. What I want you to do now is you're going to place your hands on your bottom and you're going to lean back. Okay. Any pain with that?
Nope.
Okay. I'm going to have you take one step forward and I'm going to do the same thing. You're going to cross your arms over your chest this time. Now we're going to do it from the back, applying pressure. Okay. Any pain with that?
Nope.
Okay. Go ahead and now I want you to come down to this side here.
Oh.
Yeah. Any pain with that?
Nope.
Okay. Now we're going to go ahead and do the same thing with some pressure. Any pain with that?
No.
Okay. Go ahead and come down the other side. Any pain with that?
Nope.
Okay. And I'm going to apply some pressure doing the same thing. Okay. Any pain?
No.
Okay. Go ahead and have a seat. What I want you to do now is you're going to go ahead and put your arms like this, and I want you to rotate towards me. Any pain? You can rotate back.
Oh, no.
Okay, we're going to do it again. I'm going to apply some pressure.
Okay.
How'd that feel?
Good.
Okay, we're going to do the same thing, but going to the other side. Okay. Any pain?
No.
Okay. Now we're going to do it again. I'm going to apply some pressure. How'd that feel?
Good.
Okay. Okay, now we're gonna do a little bit of your upper back. I'm gonna have you place your arms like this, like this. And I want you to bring your elbows together, and you're gonna kind of bring your elbows to your knees.
Okay.
Okay? I'm gonna apply some pressure. Alright, go ahead. Go ahead and come up, I'm sorry. Was that painful?
No.
Okay, so we're gonna do that again, and I'm gonna apply some pressure. Any pain with that?
Nope.
Okay. Any pain with that?
No.
Okay, go ahead and come up. Now I'm going to have you do the same thing, but you're going to tilt back.
Okay.
Okay. Any pain with that?
No.
Okay. So what I'm going to have you do, I'm going to go ahead and have you bring your arms together like this. And I come up like that. How does that feel? Any pain?
No.
Okay. Now I'm going to have you bring your arms up like this, but one of them you're going to cross over right here. Okay? I'm going to see how you turn. Come around this way. How does that feel? Any pain?
No. No pain.
I'm going to go ahead and do the other side now. Any pain?
No.
All right, I'm going to write that down. Okay, now I want you to go ahead and show me something that increases your pain.
For neck pain, like when I'm up in class, like on the bike, when I'm like this on the bike, like looking up like that, really increases that neck pain there.
Okay, so with physical therapy, I'm sorry, what was the pain level when you were in that position right now?
That probably went up to like a 4.
Okay. So with physical therapy, what we like to do is kind of get some baseline findings. So I want to use that as a baseline finding to see how our treatment is working.
Perfect.
Okay?
Sounds good.
All right. Next thing I'm going to have you do, we're going to go ahead and look at some of your neck motion.
Okay.
So I want you to go ahead and bring your chin to your chest as much as you can.
Okay.
How's that feel? Any pain?
Just like a little bit of pulling kind of, but it feels okay.
Okay. I'm going to do it again, but I'm going to just measure to see
Okay.
how much, okay? Okay. 35. Or, well, normal. Okay. Now we're going to do the same thing going to the back. Okay, so go ahead and go to the back.
Well, it's kind of stiff and painful.
Okay. I'm going to have you do it a little bit and just kind of pause there, and I'll take the measurement. Okay? You said it was stiff and painful?
Yeah.
Okay. Yeah, you go off a little bit to the left.
Yeah.
Okay. Now, I'm going to come behind you. I'm just going to move your hair. And we're going to go ahead and I want you to turn to the left side, okay? Like tilt your head, I'm sorry. There we go. Any pain with that?
No.
Let me bring this closer to me. Or else I'm just walking all over the room. Okay, now we're going to go to the other side.
Okay.
So same thing. Okay.
That one hurt a little bit.
That one hurt a little bit?
Yeah.
Okay. Alright, so what we're going to do now is I'm going to have you do some turning.
Okay.
So you're going to turn first to the left.
Alright.
Okay. Go ahead and turn your head looking to the left. Okay. Now I'm going to have you do the same thing to the right. Okay. How did that feel? Both directions.
The right, that definitely hurted a little bit. Hurt my neck.
Okay. Alright, that looks good. I'm gonna go ahead and have you lay down on your back now.
Okay.
Raise this up. The bed likes to be loud today. Probably bring you all the way up. Alright. Have this there. What I want you to do, sweetie, is you're gonna go ahead and scoot towards me. I kind of want your shoulders to be on the end.
That far?
Yeah, a little bit more. Perfect. Okay, just try to relax your neck. I know that going back is kind of painful for you, so I'm gonna go ahead and try and see what I can do.
Okay.
Okay. So you just try and relax your head, and you let me know how you're feeling. Okay. How's that feel?
Definitely some pain. Kind of stiff and painful.
Okay. Alright, I'm gonna go back the other way. How does that feel?
I just feel like it's kind of stretching, like just kind of pulling the back of my neck. No pain though.
Alright. I'm gonna go ahead and look at the left side. How does that feel, sweetie?
That's fine.
I'm gonna go to the right. How's that feel?
That one kind of hurts.
That kind of hurts. Okay, you can go ahead and scooch down and rest your head. Just drop some things down. So, while I have you in this position, what I want you to do is we're gonna test some of the strength in your neck muscles.
Okay.
So I want you to go ahead and kind of tilt your head and lift your head up, just like that. And I'm gonna apply some pressure here.
Okay.
You're gonna hold it up there, okay? Hold, hold, hold. Very good. And rest. That's very good. Okay. Now I'm going to go ahead and have you go into that same position,
Okay.
but I want you to go ahead and hold it. And I want to test your endurance, okay? So go ahead and hold that. You doing okay?
I'm a little tired, sorry, it's hard.
That's okay. You were able to do it for 25 seconds, so that's pretty good. But that's another kind of thing that we're gonna try and make those stronger. I'm gonna have you go ahead and turn onto your tummy now, okay?
What?
Can you go ahead
Oh,
and
I'm
turn onto
sorry.
your tummy? That's
Pay
all
attention.
right.
Yeah, of course.
So what I'm gonna do now is I'm gonna go ahead and kind of feel around on your neck.
Okay.
Actually, before I do that, I'm gonna go ahead. I want you to kind of turn your head, take it out of the hole here, kind of rest your head down. I want you to lift your head up, and I'm gonna test the muscles kind of like I did with the other side. Okay.
Oh, okay.
So one, hold, hold, hold. How did that feel?
Oh, that was okay.
Okay, we'll go to the other side. Hold, hold, hold.
Yeah, a little bit of pain.
A little bit of pain with that one.
Yeah.
Okay. All right. Now I'm gonna go ahead and kind of feel around. You let me know what's going on. So here's your first vertebrae. How does that one feel?
It's okay.
Here's number 2 actually. First ones are gonna be right over here. I'm gonna test the left side. How did that feel?
That side felt good.
Okay, and I'm gonna go to the right side. It feels a little more stiff. How does it feel?
There's a little bit of pain with that.
Okay.
Not too bad though.
Well, while I'm here, I think I'm gonna mobilize this. I'm gonna try and move it around a little bit, so you let me know how that feels, okay? All right, I want you to go ahead and sit up for me. Careful, because the bed was a little high. Okay, how are you feeling? Any dizziness? Anything
No,
like that?
just kind of like a little bit of a headache though. Kind of brought that
A little
on.
bit of a headache?
Yeah.
Okay. How does the neck feel?
Definitely looser, but it's kind of just sore. So,
Okay.
yeah.
All right. Now I want to teach you an exercise.
Okay.
To kind of that I think will help reinforce what I did.
Okay.
Okay. So what you're gonna do is I want you to sit up nice and tall. Okay. I want you to bring your shoulders up and then back, and then just let them slide down your back. Okay. And I want you to feel like there's a string right up here at the top of your head, just kind of pulling you up, like you're just growing right where you are, like a beautiful tree. Okay, perfect. Now, in that position, does that feel comfortable? Feel okay?
Yeah, I'd have to work at it for
Yeah.
sure. Yeah.
In that position, I want you to kind of tuck your chin back, okay? And what are you feeling when you do that?
Like I have a double chin. I just a little bit of pulling back there, but no pain though.
Okay, so what I want you to be feeling is a stretch.
Okay.
Do you feel like that pulling is kind of a stretching sensation?
Yeah, probably.
Okay, so I want you to do that, and I want you to kind of hold it for about, we'll do 10 seconds.
Okay.
And I want you to do that 10 times, okay?
Okay.
Write some things down while you're doing that, okay?
One more.
Okay, that's fine. All right. What is the pain level in your neck now?
Probably up to like a 4.
4?
Yeah.
What about the headache right now?
Like a 2.
2. Okay. What I want you to do now is I want you to kind of look up. How does that feel?
A little better. Still some pain with it, but yeah, it feels a little bit looser now. So.
Okay. Can I go ahead and do you remember that position that I had you to get into a little while where you were like pretending you were on your bike?
Oh yeah.
Go ahead and get into that position and let me know how it feels.
Oh yeah, definitely can move it a little bit more.
Okay.
Yeah, looser for sure.
Okay, that's good. That's what I want. Okay. So what I want you to do is that exercise that I just showed you, I want you to go ahead and do that at home.
Okay.
I want you to do that same thing 10 times, holding for about 10 seconds. And I want you to do that probably 3 times a day. Okay, so first thing when you wake up, especially before you go to bed, since you were having some trouble falling asleep, and I really think that'll help.
Okay.
And then probably sometime during the midday, maybe after your exercise class. I think that'll be after or before. And I think that'll really help. What's going on is the muscles back there are very tight, and so we want to stretch them out because that tightness is causing that headache that you're feeling. And so what we're going to do is we're going to try and stretch them out and kind of strengthen up here because these are tight because they're overworking.
Okay.
So they're working too hard to kind of keep your head up.
Yeah.
That these ones aren't working, so I want to strengthen these. I want to stretch those out.
Okay.
So for that, I want to see you probably about 2 times a week for over a course of 6 weeks. I don't think we'll necessarily need all of that, but I just want to be safe in case we need more than I'm expecting.
Sounds good.
Yeah, so we'll go ahead and talk to Grace up front, and we will get you scheduled, okay?
Okay, sounds good.
Awesome.
Thank you.